Detectives, innovators, counselors, advocates, and humanitarians, you're invited to meet the medical doctors of the OC Healthcare Agency.
My name is Annalisa Stonehill, and I'm a child and adolescent psychiatrist with the County of Orange. And before I was a physician, I was a nurse, a registered nurse, and I also got an undergraduate degree in dramatic literature that was primarily Shakespeare. So I went to medical school at Northwestern University, and I did my internship at Northwestern University, and then I did my residency at the University of California, Irvine, and I did my fellowship in child and adolescent psychiatry at the University of California, Irvine. And I've been with the county for 16 years. And before then, I was in private practice. I come from a medical family. Both of my parents were physicians. My father was a surgeon, an ophthalmologist, and my mother was an obstetrician gynecologist who became a psychiatrist. So I think probably I went into psychiatry because of my mother. And, my mother was a great inspiration to me. So that's really why I think I became a psychiatrist. And then, when I was in medical school, we go through clerkships. And in those clerkships, you rotate through different specialty areas. And you can find an area where your gifts fit in best. I thought of being an ophthalmologist like my father, but really it wasn't easy for me because it's a very kind of performance IQ type of specialty where you have to use a lot of machines, and my gifts are more verbal. So that's what made me become a psychiatrist, really my mother, because I grew up surrounded by psychiatrists, and I've worked in psychiatric clinics since I was 11. I worked with my mother in psychiatric clinics. I worked with some very, very famous psychiatrists in those clinics in Chicago, where I'm from. I speak Spanish and Italian, and of course I don't have a lot of Italian patients, but I do have a lot of Spanish-speaking patients, and so that's fun for me to speak another language. What I like most about my job is that I treat children that are very impoverished and really probably would have trouble getting help elsewhere, and so to me, it's a very altruistic and philanthropic, not that I don't get paid well, because I do, but it's a wonderful specialty because I can help all these children. So it's very meaningful. It makes my life very meaningful. Destigmatizing mental illness in children, depression, the use of our medications, which are not addictive and are really so helpful to children and adolescents. So I would hope that there would be a broader understanding and acceptance of both, the medications we use and the treatments that we do.